Welcome to Danubio Chiropractic. My name is Dr. Danubio, and I'd like to talk a little bit about chiropractic today in terms of health and wellness. More specifically, I'd like to touch upon both spinal structure as well as spinal function. As you know, spinal function is solely dependent on how well and how healthy the nervous system does function. And, of course, it connects every muscle, organ, tissue in the body. It literally runs the body. So having said that, knowing that the spinal structure contains the nervous system, it's vitally important that the proper alignment in the spine is maintained. As most of us understand, any pressure or misalignment on any one of these segments can cause the spine, the nervous system, to be irritated to the point where eventually our health will become a downward spiral. Over a period of time, as this continues to be out of alignment, putting pressure on joints and nerves eventually causes us to develop what we call symptoms. As most of us know, developing symptoms means taking a powder, potion, or pill just to mask them. As most of us had in the past, we've run to medical doctors trying to get something of a prescription, over-the-counter drug or medication to actually mask the problem. As a chiropractor, however, our approach is quite different. Our approach deals with the underlying cause of the problem. The underlying cause of the problem obviously has to do with nervous system dysfunction, or what we call dis-ease, or lack of function. So our goal is to restore normal function to that nervous system, to allow pressure to come off the nerve, and to rebuild and stabilize the spinal structure, as well as the function to optimally be at the level of optimum health for those patients that we treat each and every day. Think of it this way. If I was driving down the street and all of a sudden an oil light went on and I saw the oil light, I would have basically two choices, and I'm correlating this with symptoms in the body. If the oil light went on, my choice would be I can ignore it, or I can do something about what's causing the problem. Most of us, and again correlating it to symptoms, would take something for it or do something for it. In this case, would probably put oil in the engine to alleviate the problem, or at least having the light go off. Some of us would actually go to the point where they just want to tape the light and not even see the light. But on the other hand, what would we do to actually look at the cause of the problem? What's the underlying cause of that problem as to what triggered the oil light, or in this case, in terms of health, our symptoms? That's what we want to look at.